One visit to Guthrie and you'll realize that things are a bit different here. Maybe it's because we are physician-led and we still follow our founder's patient-centered model of care. Maybe it's because of people we work with every day really want to be here and it shows. Or maybe it's something visceral that you can't quite name and it's grounded in the beauty that surrounds us.
Guthrie Internal Medicine Residency Program is a 3-year focused program that mentors our residents with highly qualified and experienced clinicians that use the latest in medical technology and simulation. Guthrie Internal Medicine residents have the benefit of personalized one-on-one clinical learning in the context of being a part of an integrated healthcare organization. Our residents can focus on a wide variety of areas of clinical interest depending on their clinical inclination. Guthrie also emphasizes on the importance of clinical innovation, multidisciplinary teamwork, and the importance of skills to succeed in academic inquiry. We treat a variety of cases at our hospital, and we see a lot of the bread and butter cases such as the COPD cases, congestive heart failure, pneumonia. And since we rotate in subspecialty rotations, we also get to see a lot of rare cases that we only get to read in textbooks.
I chose Guthrie's Internal Medicine Residency program because it has a very strong clinical program and it is a very large tertiary care center. And despite being such a large tertiary care center, we get very close interactions with our attendings. We get very close one-on-one interaction with the attendings in many of our rotations, which really enhances our learning experience. The most surprising thing I learned when coming to this program is how close the residents really are with one another. I wasn't expecting it to be like such a close family. We really spend a lot of time together and look out for one another and really encourage each other's success here, and it really feels like a family.
Here at Guthrie, culture of learning is deeply ingrained. We as a resident feel that we are learning something new every day. All the faculties, residents, fellows are very supportive. They seek for, they suggest, and they bring up new skills in learning. I also feel that Guthrie has improvised its didactic sessions, which includes new modern advances in learning. That also helps us to meet the core values of patient care here at Guthrie.
Residents choose Guthrie's Internal Medicine Residency Program because of the ability to train in some of the finest physicians in the field. We have vigorous training in all 6 of the ACGME competencies. We have a high level of residency participation and programming development, and we have personalized attention in educational development. As a resident, you see patients in a variety of clinical settings, and Guthrie subspecialists are an integral part of the teaching culture and welcome opportunities to consult with the residents. If you were to walk around and ask me or the other residents what one of their favorite things about the program is, they will tell you the relationships you gain with each other, their mentors, and patients.
In addition to the excellent curriculum, the system-based practice is a unique feature of our program. The second years are required to brainstorm ideas to lead quality improvement projects, while the first years work on case reports, and these are then published on the Stanley Conklin Research Day. With great mentorship, the residents get multiple research opportunities, including systematic review, publications, posters. The efforts put in by the residents are phenomenal and have been widely recognized in multiple societies, including ACP, ACG, ACC, AMA, National Initiative, and many more.
There's a lot of stuff to do around the area. Within 30 minutes to 2 hours away, you have a lot of hiking, a lot of state parks. And there's the Finger Lakes, which have some really incredible wine trails. And then for us in particular, the residents like to get together at each other's houses or throw smaller parties for either our kids or like holiday parties. We'll also have some program-sponsored events where we'll get together, so we get that day off to kind of just decompress and hang out with each other. There's a lot of restaurants around here, especially within 30 minutes or so. You'll have New York, which is only 4 hours away for New York City, and then Philadelphia is only about 4 hours away as well. So within a day's trip, you can do a lot around here, especially if you're in your outdoor stuff. We do have the Pocono Mountains, we do have the Adirondack Mountains. There's a lot of activities when you get the time to do so.
We can give you many reasons why you should choose internal medicine residency program with Guthrie. But if it's one thing we hope you take away is that we are a family, and as a resident you are supported. Guthrie ensures that you walk away as a competent practicing physician or as someone who is ready to take a leap into a fellowship program.